He's
So-
been out shoveling snow
He has been.
I've been
And-
shoveling snow.
and
No sore back, no pain, nothing.
How was the life before the surgery, though?
It was terrible.
terrible.
Tell me
It
about
was,
it.
I got to the point where over the last 47
Mm-hmm.
years, that a year ago I could, or not a year ago, about a year ago, I could barely drive.
Mm-hmm.
I couldn't stand. I couldn't sit. Sitting on the toilet was like sitting on a whole bunch of razor blades. It was horrible.
Mm-hmm.
And but now I'm just pain free after
Yeah.
this surgery.
No, this is what we did. We did a spinal fusion. We two of the discs were pushing on the nerve. That's what the pain coming from. And here, look at that. These are the screws. They are perfect. The bone is actually beautifully growing, both in the front and the back. And tell me, do you remember that surgery was about a year ago, right?
Yes, it was. It was exactly a year ago today.
And do you remember it?
I do remember it very well. I was so happy right after recovery. I was
Yeah.
pain free.
No, and you said you almost wanted to go home same day, but she made you stay another night.
I
What
know.
do- So
Just
tell
in
me about
case
it.
something went,
Yeah.
there was a problem, she wanted me to stay there.
When
But
when did that horrible leg pain go away?
when I came out of recovery, it was
Yeah.
gone.
Yeah, that was gone.
Yeah, it was totally, and it's never come back.
Yeah.
he asked me, they got him off the cart, put him on the hospital bed, and he looked at me and he said, "Oh, hi." He said, "Could we go for a walk? I don't have any pain."
Now, your surgery was a transcamin olive, the technique that we teach to other people free of charge. We give it to our competitors. We
Yeah.
do.
Yeah,
And because we see the effect of that, people who have been told you have to live with this horrible pain, we can do your surgery was 55 minutes. We lost a 2 spoon of blood. That's it. And you could have gone home same day.
yes.
And
yeah.
the some insurances are giving us a very, very hard time. They patient have to get the old-fashioned surgery, where you get massacred, you have a liter or 2 of blood loss, and recovery is now 6 months to a year.
Yeah.
I need your help there.
That is why I never got this fixed, because when I had that first surgery where they open up my back and stuff like that, it was a horrible surgery and it didn't take care of the problem. And
Yeah.
so I had to learn how to walk all over again. And so I lived with it for 47 years until this surgery here. It's just a miracle as far as
Well,
I'm concerned.
You know, I hate to say that. 80% of the surgeries performed in the United States are 2 surgeries. We call them PLIF and TLIF. PLIF came to existence in 1950s,
Wow.
and TLIF came to existence in 1980s. So imagine they are still driving a car with the standards of 1950s and 1980s.
Yeah.
And those insurances approve that, but some of them, not all of them, but some of them are telling us, don't do the surgery I just did for you a year ago. And that is something I think, we have to go to our politician. We have to talk to regulators. I think this is beyond the financial interest of a small group of people.
Yeah,
This is a public health issue.
it
I
is.
agree with that.
And, I hope you never need me, but I need your help to help other people who are in your situation a year ago.
Absolutely.
Will you help me?
Yes, I will. To me, this is quality of life,
Mm-hmm.
and this is it's the best thing that's ever happened to me,
Well.
besides my life.
Sometimes I hear though, your sweetheart doesn't like you anymore if you are in pain for years. You cannot participate.
Yeah.
You're not part of the family. You moan and complain. I have seen many good relationship breaking
Yes.
because of this.
Yeah.
And
Yeah.
this is and it's nothing unusual at all. And in this situation, mostly administrators, and unfortunately some surgeon as well, give the help to administration with that. They make a decision on behalf of patient. And our petition we started is to give the choice to the patient
Yes.
to decide.
Absolutely.
Thank you.
Yeah.